Today, we're diving into a really sensitive topic, but one that's so important: male infertility. We're going to talk about a common cause that often flies under the radar, and, most importantly, show you that there are clear, proven ways to fix it. So, let's get right into it. You know, this is a question that brings so much frustration and heartache for countless couples. Your wife's tests come back, everything looks great, everything's normal, but still, no pregnancy. It's confusing, it's exhausting. But what if the answer is hiding in a place you haven't thought to look?
Well, very often the source of the trouble is exactly that, a hidden problem. We're talking about an issue with the male partner, specifically an infection that's not obvious. It doesn't show up in a routine checkup. It's an infection that's happening right inside the semen itself.
The medical name for this condition is pyospermia. And all that really means is that there are pus cells, which are basically just your body's little soldier cells, white blood cells trying to fight off an infection, in the semen. It's a huge, flashing biological signal that something's not right.
So why is this such a game changer for fertility? Well, this kind of infection is just absolutely devastating to sperm. It literally damages their physical structure, it lowers the overall sperm count, and it seriously messes with their motility, their ability to swim. When you add all that up, it can make getting pregnant next to impossible.
Okay, so you might be thinking, why not just take some antibiotics? Here's the tricky part. Your standard antibiotics, the ones you'd get for most other issues, they just don't work here. They travel through your bloodstream, but they can't actually get into the little pockets where the semen is produced and where the infection is hiding out. It's like the infection has found a safe house. That's why you need a specialized game plan.
And to get that game plan right, a doctor first has to figure out which type of infection they're up against, because this isn't a one-size-fits-all problem. There are a few different culprits.
So the number one cause by a long shot is a bacterial infection. A lot of times this actually starts as something simple, like a UTI that maybe didn't get fully cleared up. Those bacteria are sneaky. They can retreat and set up a long-term camp in the prostate or seminal vesicles. But it can also be a fungal infection or even a viral one. Pinpointing the exact cause is absolutely the most important first step.
Which brings us to the good news, the solutions. There's a clear path to recovery, and it's built around several proven methods that we can break down into 3 simple pathways.
So, to make this super easy to follow, think of it like this. First, there's the direct medical treatment. Second, there are the behaviors you need to manage during treatment. And third, there are the lifestyle and hygiene habits that help you heal and stay healthy for the long run.
Okay, pathway number 1 is all about the medicine. This is a targeted strike prescribed by your doctor. If the infection is bacterial, you get special antibiotics that can actually reach the infection's hideout. If it's a fungus, you get antifungals, viral, antivirals. It's a specific weapon for a specific enemy. And often, a doctor will also prescribe an anti-inflammatory to bring down swelling and help the main medication do its job even better.
But look, medicine on its own might not be the whole story. The next 2 pathways are all about lifestyle and precautions. Basically, everything you can do to help the medicine work and make sure this infection never, ever comes back.
So what does that look like? Well, first, if the infection is acute and painful, a temporary break from sexual activity can help with the discomfort and also prevents you from passing it to your partner. Second, and this one's huge, stay hydrated. Genuinely drinking tons of water helps to flush your whole system out. And finally, just really good personal hygiene is non-negotiable for preventing this from happening again.
Now, get ready for this, because this is a really interesting, kind of counterintuitive point. We just said abstinence can be good for acute, painful infections. But for chronic, long-term infections, the medical advice is often the complete opposite. Doctors might actually advise regular discharge because it helps to physically flush out all the infected fluid and gunk. It's like clearing the pipes. And this just perfectly shows why getting specific professional advice is so important.
And that leads us to what is maybe the single most important point of this entire conversation: why you absolutely have to see a doctor. It can be so tempting to just guess or use some old antibiotics you have lying around, but that is a terrible idea. It can be useless at best and actually dangerous at worst.
Seriously, trying to treat this yourself is a recipe for disaster. You could fail to clear the infection, or even worse, you could help create a drug-resistant bug that's way harder to get rid of later. This is just not a do-it-yourself project.
Look, a doctor is your mission control for recovery. Why? Because only they can run the right tests to figure out what you're actually dealing with. Is it bacteria, a fungus, a virus? And from there, they can give you the right drug at the right dose for the right amount of time to completely wipe it out. Plus, they can make sure there isn't some other health issue going on in the background.
When you boil it all down, it just comes down to the number one. One correct diagnosis. One correct medication. One full course of treatment. That's it. That one properly managed process can be the key that unlocks a problem that might have been causing pain for years.
So the big message here, the one I really want you to take away, is a message of hope. This condition, pyospermia, is not a life sentence. It doesn't have to be the thing that stops you from growing your family. It is absolutely treatable. But the only way, the only key, is to get that professional guidance from a doctor.
So I'll just leave you with this thought. If you're out there struggling with infertility that nobody can explain, could it be this? Could a hidden but totally treatable infection be the one thing standing in your way? The answer to that question might just be one simple doctor's visit away.